Okay, good evening and welcome back to our spring virtual Hacking Health Waterloo Cafe. Thank you very much for joining. My name is John Gregory. I'm delighted to also welcome June MacDonald as co-lead of this Hacking Health Waterloo. And June, I have a question for you. Tell me how you first became involved in Hacking Health Waterloo.
Years ago when Sarah Bingham was running it, and I forget how I came across it, but I've always loved anything to do with tech that helps people. And so the marriage of tech and health to me is just really fascinating.
Thank you, Jude. Absolutely delighted to have you working with me on this. And yeah, you've been in and around, I think, since the hackathon back in 2016, if I remember rightly. So Hacking Health Foundation is an international grassroots volunteer network. It started in 2012 in Montreal and has grown with chapters around the world, with experience in running more than 160 hackathons. Hacking Health Waterloo has been a little quiet for a while. So for the spring, we decided to partner with the Technology and Pharmacy Network in Waterloo and Toronto to help them succeed with a HackRx hackathon, and I'm absolutely delighted that they're doing so. So I invite you to tweet away HH Waterloo or hashtag HackRx. So to set the context for the upcoming hackathon, we invited a couple of pharmacy entrepreneurs to share their journey and perspective on technology. So let me introduce the first group of speakers for tonight. So Rui Su is co-founder and chief clinical officer at MedMe Health, a pharmacy care platform that empowers pharmacists to deliver clinical services at scale. Previously, Rui worked at SDM Health Services North, Adet Cancer Center, and healthcare startups in Canada and San Francisco. She holds a pharmacy diploma, degree from the University of Waterloo. Now, MedMe Health has just been accepted to Mars IAF portfolio. Rui, you'll have to tell us more about that. And I first met Rui through Hack4Health back in what I think was probably about 2017. Next is David Beynon, is one of the co-founders of ShiftPosts. He earned a degree in computer engineering from the University of Western Ontario. Over the last 15 years, he's been implementing technology-driven solutions at Fortune 500 companies, such as Honda, 3M, and Gilera, before starting ShiftPosts. And in the 2+ years since co-founding ShiftPosts, he has continued to apply the use of technology to better serve both pharmacists and pharmacies and their resourcing needs at a moment's notice. Quality and transparency are paramount to everyone at ShiftPosts. And then also joining David is Nisreen Chehimi, is community pharmacist and completed her Bachelor of Science in Pharmacy from the University of Alberta in 2018. Completing her degree, she started her pharmacy career working for a chain pharmacy before moving work as a relief pharmacist for independent pharmacies across Alberta. When Nisreen is not on the front lines working with patients, she is working as a lab facilitator in the University of Alberta's FOPPS. You have to tell us more about that, Practical Skills Labs, where she enjoys helping students learn and grow. Nisreen has a huge presence in the University of Alberta alumni community, serving as the chairperson of the events committee of the Pharmacy Alumni Association. Just what kind of wonderful to invite you and have you here. Thank you very much for being part of tonight, both in terms of your own individual perspectives on pharmacy and sharing with us kind of where you see that intersection of technology and pharmacy. The HackRx is looking at the kind of real communication between either pharmacists and pharmacists, patients, pharmacists and other healthcare professionals. So thank you all for being here. We have two more, Kate and George. I will introduce them a little bit later. So we start tonight with Rui sharing her entrepreneurial story and perspective of technology and pharmacy. And then we'll go to ShiftPosts, is one of the sponsors of the HackRx hackathon, and David will introduce ShiftPosts and hand off to Nisreen to share her experience in rural pharmacy. Rui, the floor is all yours.
Thanks so much, John. I'm just hoping that the sun will last for the duration of my talk so I don't have to hop back inside. But it's great to see everyone here. When I was living and studying in Waterloo, attended a number of the Hacking Health events, and really wish that we could get back to our normals where we could all gather in person and be able to connect in our little conversations afterwards. But it's a pleasure to be here today, and especially to kick off the HackRx hackathon, because it's absolutely something I would have wanted to attend and be part of when I was a student, and something that really has just been coming. And I'm glad that Kate and George have taken the reins up to organize and run it even during these exceptional circumstances. So perhaps for my talk today, I'll just break it down into a couple of different parts. First, I'll give you a brief background about my own journey, my own unexpected journey into entrepreneurship, and how that's kind of played out over the last year and a half. And then I'll talk a little bit more about how I see the profession of pharmacy versus the business of pharmacy, as well as the future of pharmacy care as we may know it today, and where I want to see it going. So maybe to give everyone just a bit of more background, I actually graduated. Oh, hey, my student Ethan is here. Hello, Ethan. So just to give everyone a bit of background, I graduated with my PharmD in 2018 from the University of Waterloo, so very recently. And I've always been interested in how the intersection of technology can be used within the healthcare space, especially seeing the mass innovations that's happening, especially when you are within the Waterloo ecosystem. There's always so much innovation and technology that's kind of going on. But then you would return back to the pharmacy where we're writing things with paper and pen, and we're still using the fax machine, and we still don't know when we get a piece of paper that's a prescription what I guess medical condition is actually being used for. And that disconnect was something that really bothered me for a long time. And as I went to understand more of the profession, and when I came into practice, I realized that there were so many structural pieces that prohibited us to practice to the top of our license. Like pharmacists over the last 5 to 10 years have been able to do so much, like prescribe medications. We talked about Nisreen in Alberta. She, like with your advanced practitioner's degree, you can really prescribe any medications. You can be the expert in managing treatments, and the physicians can be the diagnosis experts, while pharmacists can be those treatment experts. We're also the most accessible. There is no other business out there where you can call at any time and get free healthcare advice. And that's extremely helpful in both urban and rural communities for people to have their front lines of health advice, and for that to prevent admissions, prevent ER visits, and for us to be able to triage these individuals. Also, when it comes to chronic disease management and being able to keep your blood pressure in control, to prevent heart disease, respiratory issues, we are on the front lines of that. And we are doing our job right when you don't know that there's anything happening. So we're doing our job right when you never receive a call from your pharmacist because we've caught any error that has come up. And so seeing what we're capable of doing within the healthcare system, but also seeing the structural pieces, the software that was built 25 years ago, that was built for a profession that used to focus on just getting prescription and giving it to you. Back in the day, we weren't even allowed to change anything or do anything. We just had to follow the instructions, that piece of paper that was given to us. And so if software was built with the context of that, then what does that mean for the context of today when we're the treatment experts? How is that software going to be able to be changed to what we need now? It's like it's like if all you have known is horses and all you have as your form of transportation is the horse, you wouldn't know that a car would allow you to go like hundreds of kilometers and actually be able to visit family that's like across the province somewhere when all you know is a horse. It's kind of like a weird analogy, but I think what I'm trying to say here is that because the existing tools that pharmacists were using were not designed and built for what they are practicing to the top of their license today, that's a huge barrier to being able to deliver to that maximum that we can. But there's also other structural forces, and that's in terms of government reimbursement. When we don't have data and information to actually show people, hey, we actually called 20 patients today and made an intervention that actually maybe prevented them from going to the hospital or prevented them from having a side effect in their medication. Because we don't document any of that, governments don't really see our value and don't reimburse us for these services that we provide. So there's that government and reimbursement piece in terms of how we get paid. But there's also the structural and advocacy piece, because I'm sure that maybe you know a friend or family that probably just thinks of pharmacists as people that are behind the counter and that just count pills. And that is a branding challenge and an advocacy challenge where we don't represent ourselves enough in the best light to the general public as to what we can do. So there's so many of these structural pieces that are roadblocks to us being able to support a more sustainable healthcare system. And I saw these issues as something that could not be changed by me just working within a pharmacy practice. And I wanted to do more. And I was lucky to actually meet my two co-founders at MedMe who also believed in the same vision, and being connected by these same values and wanting to make this change. That was where we had this idea that we could build software, at least take down one barrier out of the many barriers to open up the opportunities. And we kind of took that idea, went with it, iterated many, many times, failed many, many times, to where we are now, where we're in over 1,200 pharmacies, kind of coast to coast in Canada, and really being able to deliver that impact with the software and the workflow changes that pharmacists need today. And part of why I talk about my journey being unconventional is because I didn't really see other pharmacists that were in this role, other pharmacists who stepped into entrepreneurship. And when I look at founders from the Silicon Valley, I typically see technologists, engineers solving problems, and not really somebody that looks like me, that doesn't have any technical experience to be able to step up to that role. And additionally, there was that lack of exposure to communities like this, where we could really speak about what pharmacists can do, communities rooted in looking at the pharmacist profession with a different lens and collaborating with other people, other interdisciplinary people, to be able to understand, how do engineers think? How do designers think? And how can we collaborate together, understand what each other is saying across the board, and co-design solutions in that lens? We've all seen a number of pieces coming out from like Google and the big tech giants, where there are huge biases in some of the algorithms that have been built. And that is a strict reflection of what happens when the people who are using the technology and being affected by the technology don't have a voice or a means to dictate how things are designed from day one. And I think that as a profession, it's important through school, through when we're beginning, through mid-late practice, to be able to engage critically in these discussions and be able to really work within that multidisciplinary, interdisciplinary world that we are going into now, where software is more prevalent. I mean, the COVID pandemic has really accelerated the pace of technological change, especially within digital health, where we are getting to a point where before governments were hemming and hawing about allowing virtual care, allowing reimbursements for virtual care, whether this is possible. But now, because of this acceleration, we're getting to a point where that technology is so prevalent within our lives, that within each industry that we touch, it's absolutely critical that the people who are going to be using the technology have a seat at the table when it comes to the design, the execution, as well as the further iteration and development of all of that. And this is where I really think having communities like this and having hackathons where from an early stage, you have students of all disciplines coming together and thinking about problems is where that needs to start. And my two co-founders, they're not pharmacists at all. One of them is a health data scientist who worked within consulting. The other one is a product engineer. So he has a UI UX design expertise, but also an engineering lens in terms of looking at the product. And that's where that intersection has been so successful in our journey, in leveraging how to think about data structures, how to think about data privacy, how to put like the Toyota or Tesla manufacturing lens into pharmacy workflows and change management, because it's not about plopping a piece of technology in front of any industry. It's about thinking how that can bring value to the end users, how that can actually impact the pharmacists and the patients that are using that technology. I'm not a techno optimist that I think technology can solve everything. I think that it requires context and critical reflection when you're looking at problems, because not every problem requires a software solution. And oftentimes, especially in healthcare, it requires more social supports. It requires a government structures to change. But within the pieces of what we know and what our skills are within, if we can change some section of it, there is a possibility for impact. So that's kind of like my entrepreneurial journey in a nutshell. In terms of where pharmacy is going, I heard about this fact recently that really surprised me. So over the last year, as you all know, online pharmacies and the proliferation of online pharmacies have grown significantly. There's been millions, if not billions of dollars of venture money that's been poured into online pharmacies. So much so that there is a company that just went public where they have been in operations for like 5 years, and they deliver like erectile dysfunction medications and contraception, like birth control medications, to patients online. And they're worth $1.3 billion versus a Rite Aid, which has been in business for so many years with so many brick and mortar pharmacies in the States, is also worth that equivalent amount of money. And so when I see this sea of change happening, people's idea of innovation within pharmacy becomes fixated on faster delivery, more convenience, cheaper costs. And that's Amazon's model, right? That's how Amazon is kind of taking over the market. And when we see DoorDash, Uber Eats, all of these online plays that are worth billions of dollars, it's with the underlying, I guess, mentality of increased convenience and decreased costs. But there ought to be industries where that should not be the status quo, where that should not be the underlying intent of the business, to decrease costs and increase convenience. Because in healthcare, if you purely decrease costs and only increase convenience without thinking about the care aspect, without thinking about the longer term impacts of that on the patient, you're in for a bit of an issue. And where I'm really trying to advocate within the future of pharmacy is shifting people's perception from the business of pharmacy and sending out more pills for cheap into the profession of pharmacy. How can we leverage these extremely, extremely qualified clinicians in all that they can do, and being able to provide vaccinations, injections, being able to interpret how your routine blood work is and make changes for your blood pressure medication, being able to monitor and help with all of the complicated cancer drugs that are coming out, where you have to take it in an infusion once a month, once a week, and being able to monitor for all the complications of that. How can we leverage these people and take them from verifying medications behind a counter to actually being a true advocate of a more sustainable healthcare system as we see it? And how can we shift that mentality within the investor pool, within what even a student, when they come in, to think about innovation as not just innovation within faster, quicker medication delivery, but more about innovation within the systems of healthcare and how patients can get better care that way. And that's where I think the future of pharmacy needs to go, where I see that your brick and mortar pharmacy is going to transform into a future community health hub. In a way, we are right now. We are right now in so many different locations where we can get you your medications and provide advice. But what if we see in a decade from now an extension of that, where you can get all of your healthcare, you can have an interdisciplinary team of other nurses, dietitians, physiotherapists providing you care, integrated with that digital experience, where you can also get your medications delivered, but you still can get your blood tests and your testing and that care from the clinician. And that's where I think we need to move the conversation, move it away from the convenience of delivery, and move it in terms of more about the sustainability of our future healthcare system.
Rui, I love so much of what you just said. I could carry on listening and talking to you for hours. Yeah, I mean, it really is about the value of the pharmacist and the experience and the qualification and that you do bring. And absolutely, you are the most accessible healthcare professional. Now, I've known you for a while. You are very smart and very curious. I'm not surprised that you are a successful entrepreneur, and it's lovely to hear that you've surrounded yourself with co-design and other smart people. I look forward to watching your journey. Thank you for setting this off. It was absolutely wonderful. What I might do is hand over kind of fairly quickly, maybe to Dave. Maybe you're welcome to pick up on anything kind of resaid, and then after Dave and Nisreen, then we'll open up a little bit for a chat, and then we'll invite in Kate and George to talk about the hackathon coming up at the end of the month. Sure. Dave, over to you.
Yeah, thanks, Sean.
Thank you so much.
Yeah, and also wanted to say thanks everyone who is behind organizing this event. It's really exciting to be involved. I think kind of carrying from where Rui started, ShiftPosts has been around for about two and a half years, maybe a little longer in a sort of alpha stage. And something that you mentioned that resonated, that, tripped a thought in my mind was how we got started. And I think there's some similarities. There was the whole status quo of how pharmacies and whether it's independent or corporate would go about on short notice filling shifts. As we all know, dispensaries can't open without the expertise, and the law also states that they can't open. So we saw a gap in the market where there was the traditional agency model where you didn't know who was coming. There was a bit of a lack of transparency. A lot of the feedback we also got was there was a very wide range of quality that agencies would provide. So we set out to disrupt that using technology. There was also some, repetitive steps that occur in HR, and this isn't unique to pharmacy, but if a highly qualified individual or is hired and needs a background check or needs a license validated, every single time a person does that, that's on an HR department or an individual. So with our platform, a lot of those repetitive tasks that would need to be happening over and over or if it's a background check that a person needs to pay for, where those sorts of activities would need to happen repetitively, we've centralized those so that candidates and those responsible for hiring have a sort of a hub where they can, in a very transparent way, see who the individual is. You know, have they been background checked? Are they licensed? Is that valid? Are there infractions, et cetera, as I'm sure you can imagine. So that's what we set out to build. And we have heard, which is part of the reason we have Nisreen here is, you know, she's been on our platform a while. She's a fantastic pharmacist, absolute rock star, who actually uses it. So, you know, it's not just me here touting what we do, but, you know, we wanted to give you guys a sample of some real world experience of using it. So yeah, that's what we set out to do. It's a very simple app. You know, we're always expanding and adding different things that we hear from the industry, from both sides. What else can I tell you? Yeah, I think that's, in a nutshell, that's what we do. We've got a very, very simple and clean service that we've gotten lots of accolades for. And I think with that, I can probably pass it over to Nisreen to share a bit about her experience from her side of the equation.
Hey guys, yeah, so actually as I speak here, can you hear me?
Yeah, we can hear you just about.
Okay. All right, sorry. Actually, yeah, thanks, Dave. So yeah, actually, as I speak here, I'm actually working out of Athabasca, so rural Alberta. So yeah, as a traveling relief pharmacist, I'm always on the go and constantly in motion, and which is really why I always strive to find the most effective way to do things. And I really can't imagine working the way I do without ShiftPosts. So ShiftPosts is an online app that connects like pharmacy employers looking to hire with pharmacists like myself looking for work. So it really does act as my virtual office, and I find pretty much all my work through this app. So I'm able to easily log on to the app, look at the shifts that are available, and I pick and choose which ones work best for me. So I can accept or decline shifts really with no stress or hassle. And I think this is amazing for pharmacies as well. And yeah, like out here in Athabasca, there's an outbreak of COVID. So the pharmacist needed someone to come in quickly. And she even mentioned that it was super easy to get that all done through the app. So the app lays out available shifts from pharmacies. So the pharmacy employers can sort of detail everything that they're looking for in pharmacists. I'll discuss dates and times for shifts, the pharmacy software. So I'm able to understand sort of what the pharmacy sort of does day to day, and they also kind of indicate any required professional skills like injection services or prescribing authorization. So it's super accessible as well. So I'm able to really easily message employers as well. So like if I need some additional information, all that's kind of readily available to me at the click of a button. So I find like really, because I'm self-employed, it's tough to really manage my schedule and like coordinate with multiple employers on the go. So I'm just like I've created my profile and I'm able to find shifts near me. So I don't really have to play that phone tag or, you know, check WhatsApp groups or Facebook groups. Like, you know, ShiftPosts will start notifies me when there's a shift that's available. So really, all in all, like this app has really like allowed me to restructure my time, and so I really now spend less time, you know, waiting through communication inefficiencies and going back and forth with employers, calling and emailing for various people for shifts. So it's definitely been a great thing for me and as a relief pharmacist. And so yeah, that's sort of my experience, and yeah, it's great.
Thanks, Nisreen.
Yeah, thank you both. So yeah, I mean, a question. Sorry, Dave, did you want to kind of wrap up, or I mean, there were questions for you and Nisreen, and I remember you, Rui, as well.
Yeah, I'll wrap up real quick. I know there's a little background noise there, so it may have been a little hard to hear. But yeah, really what the app is meant to do is, you know, I think a lot of what Rui touched on was things that will affect the quality of service to patients, like things on the back. I don't know a lot about Rui service, but it sounds like they've built a platform that allows the pharmacist to improve the quality of care to the patient. One of those things from our perspective is, you know, ensuring that the pharmacist that's in the pharmacy is actually able to do that, and we strive to do that through a lot of our qualification and background checks that we do before even letting a person on the platform. It's not we don't let just anyone come on. You sign up and there's an approval process. So that's part one, and then like Nisreen touched on and I touched on before, the transparency, you know, being able to see that at a moment's notice, whether it's hiring someone for, you know, one shift that you need tomorrow that's super urgent, or if you're looking to hire someone full-time, we go over and above the competition to ensure that both our clients who use the platform are happy, but ultimately at the end of the day, the patients are getting top-notch service from killer pharmacists. So that's ShiftPosts in a nutshell.
Yeah, so I could definitely just add on as well. Yeah, I think the accountability as well that's built in the platform is amazing. So you are rated as a pharmacist after you leave the pharmacy. So it's an amazing opportunity for you to, like, you know, if there's any feedback or anything from the pharmacy, it allows you to grow with the pharmacist. And I've definitely, I think, in certain ways, taken that feedback and grown as a pharmacist. So just wanted to add that in.
Thank you, Nisreen. Yeah, no, thank you very much. There was a little bit of muffled kind of background noise, maybe a little bit. So any questions from anyone in this cafe tonight for Rui, Dave, or Nisreen? Not for the moment. There will be plenty of opportunity to do so. So what I will potentially do is hand off shortly to invite Kate and George to tell you more about Technology and Pharmacy Network and the planned hackathon RX starting on April 30th. So let me introduce Kate and George first. So Caitlin is a fourth-year Doctor of Pharmacy student at the University of Waterloo. She co-founded the Technology and Pharmacy Network to improve the understanding of tech utilization within the healthcare system and accelerate the adaptation of technology for healthcare. Currently, Kate has been actively working on an exciting initiative, the first pharmacy technology hackathon, which is what we're talking about. She's thrilled to launch the event to engage bright-minded students from pharmacy, medicine, computer science, engineering, and more, many more, hopefully. George Daskalakis is president and co-founder of Technology and Pharmacy Network and a committee member of Ontario Pharmacists Association. George is an advocate for the increased utilization of pharmacists to address many of the healthcare system's inefficiencies, including the high rate of non-optimized medication regimens. He has a track record of advocating for the pharmacy profession and believes that the potential of pharmacists will be unlocked through the better integration of technology into the field. And I can certainly speak to that. George is also a member of our Hacking Health Waterloo committee. Very delighted to have him involved in that and to increase and advocate for the role of pharmacy. So let me hand off to maybe Kate first, and Kate or George, that's up to you in terms of how you double act between you. Maybe to start to share with us a little bit about maybe what to expect from the hackathon at the end of the month, what the theme is, and what maybe we can do.
Sure. Yeah. So I think could start by just giving a little bit. I think everyone's done a really good job so far of giving a background of the whole issue, but I'll give a little bit of more background and a bit of a rationale for why we're focusing with the particular topic that we've chosen for this hackathon, because there are a lot of topics that could have been chosen. And I think Kate, who's really held the vision and spearheaded this, will go more so into the details. So I think for anyone, there's always a hesitation that people have when it comes to, okay, pharmacist, clinical work, what are you talking about? They just count pills. And that misconception just takes persistence to break down. These are people, pharmacists, who graduate with the degree and title of a doctor of pharmacy, PharmD, doctor of pharmacy. They are experts in medication. And if you have, this is something that's, the field has been trying to become more and more clinical for, if you look in the academic literature, for decades, it's been trying to make this push. And I think really right now we're at a point where that is becoming very, very apparent in the public eye. If you look at the COVID-19 vaccination efforts, we're well known for flu shots. We're going to become very well known for COVID vaccines. Our projections are that we're going to be giving around 1 million doses in Ontario per week. 1 million doses through our pharmacies by pharmacists. That is really pushing our profession in the way of clinical light in the view of the public. And it's interesting, while they're rolling this out, the executive vice president of Shoppers Drug Mart, Ashish Desai, he called the framework and the software that they're putting forward to put this out. He said, this is laying the groundwork of our future in clinical work. And I like being a student because I can critique things. The thing is, if you look at that software, it is archaic. It is very archaic. It's part of the software is Salesforce, has nothing to do with medicine. And that is just indicative of how archaic the technology is that we use in pharmacy. And, you know, Rui compared the technology we use in pharmacy to horses. I really like that analogy. Let's say horses versus a car, right? I think I'm going to use for an analogy something Steve Jobs said. Anytime we're thinking about innovation, Steve Jobs definitely comes to mind. So he called the personal computer the bicycle of the mind, because it allows you to, you know, do things that you might not be able to do. The personal computer is the bicycle of the mind. The problem in pharmacy is that the bicycles we use in terms of personal computer applications are rusty old bikes that you find in the springtime when you pull your bike out of the shed to go biking. They're rusty old bikes. And when we're talking about all this clinical potential of pharmacists not being unleashed, it's because we're using rusty bikes. We're stuck using applications that are horrible, that are trash. And yes, according to the executive vice president of Shoppers Drug Mart, they're laying the groundwork for our future, but we're laying the groundwork with some rusty bicycles. And we've been using rusty bicycles for a long time. So what are some examples of rusty bicycles in the context of the topic of the hackathon that we are trying to fix? So our topic is communication. And the funny thing, it's communication between providers, pharmacy, which is a provider, and patients, all those people. The funny thing is that the majority of that communication takes place through a rusty bike called the fax machine. So while everybody uses instant messaging to get things done, to rectify problems, email to rectify problems, we use the fax machine still to this day. Another example of a rusty bike in the context of communication would be in Ontario. There is no comprehensive database with all the medications that a particular patient is taking. This is known as a drug information system. No system like that exists, a very vital piece of communication. So whenever a patient is admitted to hospital, a pharmacy professional of some sort, usually a student or an intern, is tasked with calling each pharmacy that the patient visits to obtain the list of medications that they get. Huge waste of time, huge waste of the clinical potential that that student or intern or pharmacist has. And just an example of a rusty bike again. Then when these let's say this person goes through the hospital, we figured out their medications, the new medications they're going to be put on are sent through a fax machine in a very disorganized fashion. And this is how we change people's medicines. It's actually really sad the way we do it in society. And that's really why we wanted to go with the topic of communication, not just to fix problems, but because it also opens the potential to build on things that don't even exist yet. To communicate, for example, you have a prescription that a pharmacist looks at. Each time they're looking at it, they're trying to determine if it's clinically or therapeutically appropriate, but they don't have all the information there. They don't have the indication. Why was it prescribed? That's going to change the way the pharmacist is going to look at a medication. If a medication is prescribed for X, the dose might be different than if it was prescribed for Y. Yet we have all these prescriptions going through. Every single prescription goes through a pharmacy in our society and isn't properly checked because that information isn't there. Then you think in terms of communication, there's also a question of, is the patient taking the medication? That's information that the pharmacist has because we're shooting that out all the time, but we don't share with the physician. So this is a two-way road. We need them, they need us, but we use fax machines, we use rusty bikes. And then if you want to take it a step further, just to kind of close up here, talked about Steve Jobs at the beginning. Think of an Apple Watch and the information that that is collecting. Blood pressure, ECG, they're talking about that potentially collecting blood glucose information. That information needs to be getting in a private and secure manner into the hands of pharmacists, into the hands of physicians, and all of that being communicated. And if we're creating an infrastructure now, once that technology, as it develops, it will be able to be better utilized. So all of our healthcare professionals, pharmacists, physicians, can take a look at that and modify medications on a very granular and specific level. So really, that's really the motivation behind the topic for our hackathon, communication. And with that, I'll pass it on to Kate, who, like I said before, has been spearheading this and has kept this alive, this initiative, even during a pandemic. And we're very excited to be tackling this problem. So I'll pass it on to you, Kate, to talk more about the HackRx 2021.
Of course. Thanks, George, for the great introduction. And so far, everyone, Rui, Dave, Nisreen, George, you guys all had a really good intro with such great quotes and analogies. So basically, I guess I would start off as why we believe that this is something that we should be moving forward, should be pushing for. So I actually completed my undergrad bachelor's degree at the University of Waterloo, and I'm currently at the University of Waterloo for the next degree for my Doctor of Pharmacy. And the reason I bring up my experience at the bachelor level is because even when I was studying for my science degree, I was surrounded by so many innovative students from computer science and engineering. And a lot of my friends outside of science, they were always talking about which hackathon to attend, which topic that they're gonna tackle on and what kind of prizes they're getting. I was always surrounded by those kind of a conversation, but I guess I never really got a chance to really indulge myself into one of those experiences. And then my time came to the pharmacy school, and it was in our second year, me and George, George and I and a few other people from the School of Pharmacy at Waterloo and Toronto, we got together and then we decided to form a nonprofit organization called Technology and Pharmacy Network. And the reason we thought this is such an important initiative to start is because even after 2 years in the program, we realized that there's significant gaps. And not only the gaps in the system, but also gaps in the understanding of how to utilize these available technologies. And oftentimes when you talk to the healthcare providers or pharmacists or physicians, they're not very familiar with the tech world per se. They're very good with, are very book smart oftentimes, but they're not very adventurous in a way that they want to explore different things. So we figured that we need to create an environment and community where people can come in and share their insights, fill in the gaps of their knowledge behind the technology and also pharmacy. And it's at the end, with those gaps filled, we can eventually advance the professional pharmacy as well as the entire healthcare system. So when we found this club or organization, we obviously invited many people from the industry, in the community, leaders in the startup environments, It was really great experience and it gave a lot of our students a great exposure to different career trajectory and how they can expose themselves to the greater world outside of the school. However, we knew that there was something missing, and it was the active thinking process. Whenever you attend an event, you tend to have speakers either in a panel or either as an individual speaker. They tell you the story, or they share their insights or advice. But it's the interaction and really the active thinking process is what's lacking. So we figured that, okay, there is gotta be a change. And we thought that hackathon is the best solution to really engage all the audiences, because first, you are in an environment where you must communicate with your interdisciplinary team members. And second, you get to meet people who you've never probably met before, or you get to interact with people in professions that you probably don't interact to day-to-day life. And third, and most importantly, is that you actually get to think and act on your thoughts. So that's why we wanted to really initiate this hackathon. So to go back a little bit, we actually wanted this hackathon to be in person, and it was supposed to be happening in September 2020. And as you already know, we're in the middle of the pandemic, and just like any other events and actions, and we had to pivot our strategy, and we decided to hold it as a virtual format. And we were thinking, okay, well, we're now changing the tactic and direction a little bit. So maybe this is a time and opportunity for us to open up that invitation to everyone in across Canada. We're not we're not only limiting our participants to come from Waterloo or Toronto, but we're inviting our medicine, pharmacy, computer science, and engineering students from all across the country. And that means we're including Memorial University from the Newfoundland, UBC from BC, we're from one end to the other end. We are actually getting a few people from all provinces so far, and it's really exciting to see these people really trying to get into the world of technology and hackathon and pharmacy. So that's where we're heading to. And I believe George already introduced the theme of the hackathon, and I think we have the great two examples of how the technology can enhance the tech communication. So for example, Rui's company, MedMe, it definitely enhances the communication between pharmacists and the entire healthcare system. And that ecosystem in advancement is something that we always needed. So through her platform, her software, she or the pharmacist can interact with the physician or the patients. Like, it really just shortens improves the efficiency and productivity, and it definitely gives the clinicians more opportunity to really utilizing their full potential. And so is the Dave's company ShiftPosts. It definitely enhances that interaction between the employers and employee, as in the pharmacist, and really strengthens that credibility as well as the productivity as well. So these are the things that we want our students to really think about. We want to open up the discussion for them to think, hey, right, that was a problem. Why aren't we doing anything about it? Let's get on it and let's actually create something tangible. And that way, maybe eventually I can expand it to my own startup and then really be the leader, leading that advancement in the healthcare system. So in the end, that's basically what we want to achieve from this hackathon. We want to engage all these technology naive or technology scared science or healthcare students to really interact with the future leaders in the technology who's graduating with the computer science degree or engineers, and then really lessen that scare, because it's something that we have to adapt to it. And if you don't adapt, we're always going to be behind. And if you are not only adapting, but also improving, and I think that will be a success, at least at this level. Then once we expose our students to be more interactive with the technology and experience that more, and I think that would allow, once these students graduate, that would allow our students to participate more in different events to really improve that overall healthcare system in whatever sector that is. So I guess that's the background and how we really wanted to, what we wanted to achieve through this hackathon. So I guess to be more detailed, so this hackathon is going to be virtual, like I said, and it's going to be happening from April 30th to May 2nd. So that's the Friday to the Sunday schedule. And we plan to have our students starting in the evening, where we'll have an opening ceremony, and then students will come together, and then they'll form a team with people they have never met. Some people come as an already made team, some people registered as a solo member, and then that will be the opportunity for our students to interact with computer science students, medical students, engineers. That will be a networking session that these people would get. And then we'll also give them some intro of the problems in the healthcare system. Just like what Rui was saying and Dave was saying, we want to introduce all these bottlenecks, so that way it gets people to think overnight, and maybe it gets them to start a discussion among their team members. And then Saturday is the hacking day. So the participants are given the entire day to hack, and in between, we will be providing some workshops to fill in these participants' gaps in their knowledge, whether it be within the healthcare system or within the technology or the digital health area. So ideally, we like to hold 2 sessions simultaneously at 2 different time slots. And we have a few speakers who will be very excited to hold their own sessions for the workshop to improve that knowledge. And then on the 3rd day, which is the last day, participants and hackers will be done with their product, and they'll be presenting their prototypes to our judges. And based on their ideas and usability and etc., it will be evaluated, and then the winner will be selected. So throughout the entire process, what we need from you, from the Hacking Health community, is we are looking for people who would be a great mentor, who have a great background who has a background in digital health, data informatics, engineering, those people, and people who are interested in mentoring students on the side along their way of brainstorming, finding a solution. We're welcoming these advisors and mentors to be part of our event. So if you know anyone in your community of your network, please let us know, and then we would love to involve these individuals to our event. And then if you are currently working with students in healthcare system, whether it be nurses, doctors, physicians, pharmacists, even dentists, right? They're all part of the healthcare ecosystem. So we want to involve all of them. And obviously, if your background is from the technology side, let them know that this is an exciting event that they can attend, and we will really appreciate your advertising for us. So yeah, that would be that would be everything from me. I would take any questions if there's any, but I'll hand it over back to you, John.
Oh, that was fantastic. Thank you very much. That was just a wonderful explanation about kind of really what to expect from the hackathon. And yeah, we really admire that, given everything that's happened in the last 12 months, that you are proceeding with this. And this is lovely to hear that you've got people from coast to coast across Canada. So any questions? Actually, there was one question that had been posted. George, I forwarded it to you. What happens if a pharmacist disagrees with a doctor's prescription?
Yeah, that's a great question, and not everybody really knows that happens. But there's about a 2 to 3% error rate with prescriptions being processed through the pharmacies. And generally speaking, when an error is detected, or we think there's just a better solution, i.e., there's a better medication, that's going to be written down, usually on a piece of paper. The pharmacy softwares we use do not really permit this. Written down and faxed over as a recommendation. In Ontario, that is funded as a pharmaceutical opinion. So a pharmacist is given by the government $15 for each time that they pull that off. So yeah, it's transmitted through a fax machine, and then we wait and see if there's a response. That's the way it works, and that's something we want to fix.
Thank you.
I
Other
would
questions?
actually add a comment, or I would add that
Thank
to
you, Kate.
George's answer. So yeah, oftentimes the decisions are not only made by the physician, it's actually made as an disciplinary conversation. So oftentimes if there is an error or if there is a better way of treating the patient, then pharmacists would give a recommendation. And usually that recommendation doesn't just say, oh, give A instead of B. We don't just communicate in that way, but rather we communicate with an evidence. So we would say A is better according to the literature that was published, or according to the RCT that was published, right? Or according to the guidelines. So we tend to add these evidence with our recommendation, which makes it more valid. And with those recommendations, I have, from my own experiences, there has been more positive acceptance rate than the negatives, because physicians generally do trust our expertise and medications, and we do have a lot more resources that are accessible to us as a pharmacist. So I think it also comes down to the way you communicate with a physician, that you're not just telling them what to do, them with higher or more accurate evidence. So in that case, I think they're more receptive. But if not, ultimately it is their decision. However, we document all of our recommendations, like George has said. So if there's any consequence to the doctor's decision, then they would have to review all the documents that was made prior to that, the decision made.
That's great. Thank you, both of you. So we've got a number of questions actually from a number of people, one allied healthcare professional and others asking about the hackathon and who can participate in it. Is it only open to students, or is it open to everybody to be involved in?
So yeah, I can answer that question. So for now, we're opening our registration to the students, but the students can be a very broad term in a way. So if you're a master's student, you can participate. If you're a PhD student with a full-time job in the background, that you can also participate. Also, if you're a medical resident or a pharmacy resident currently working in the hospital or an industry as well, even though they are fully licensed pharmacists and fully full-time job, has a full-time job, they're still considered as a student. So as long as you have some sort of courses that goes on top of your full-time job, we would consider that as a student. So, but so far it's the student only.
Okay, all right. No, thank you for clarifying that. But nevertheless, I mean, you have pointed out that you are looking for mentors. I mean, I can speak with some authority from a hacking health point of view, in the fact that we often find that those teams that are the most successful at hackathons tend to be those that make the greatest use of mentors. So yeah, make a note of that. I'll say it again. So those teams that make the most use of mentors are usually those that are the most successful at hackathon. Yeah, having a good bank of mentors and then encouraging the teams to make use of them will be very worthwhile.
John,
exactly.
There was a question about the overview of our hackathon vision. Can we take a second to
Sure.
I'll touch on a little, and then I know Kay is going to have a bit to add. One thing is really just to create an environment where, yeah, very succinctly, I'll say, is to create an environment where people can come together who typically do not come together, key point, and come up with solutions to what we believe to be the main problem towards interprofessional collaboration, and that is communication. And in one point I would add on to that is that we want actually this, our plan from the very beginning has been for this hackathon to become an annual event. So we're trying to do a very, very good job in the first year, and we want this to be, this is HackRx 2022. We'd love to see HackRx 2028 one day. But that is fully our intention, and we plan to remain committed even with the next committee that comes into.
That's great. Well, part of the hacking mentality really is experimenting, and yeah, this is a case in point. But anyway, so from my point of view, thank you again to Rui, David, Nisreen, George, and Kate for sharing their interest in pharmacy and technology. We encourage you to visit the HackRx Hackathon webpage or Technology and Pharmacy Facebook page, and it's great to learn more about it. We have shared links in the chat. We'll follow up with you afterwards as well. Don't forget to register if you're a student, a volunteer as a mentor if you're not. And then I would say keep watching the Hacking Health Waterloo meetup page for further news about other cafes in the future. And June, who has been doing much of the stuff and organising us, thank you so much. We will send out both a link and recording to the hackathon. But thank you all very much for being here. Thank you to our presenters. Enjoy the rest of your evening.
Thanks, John.
Thank you. Thanks, John.
Bye, everyone.
Everyone.
Very well.
Thanks, everyone. Appreciate it.